Hey guys, finally trying to get this recorded. Trying it in Camtasia. I don't know if that's part of the reason my computer started to crash or what, but we will try it in this and see how it goes this week. I do apologize. My daughter's dog is kind of annoying today, and you will probably hear in the background. She keeps trying to bring toys to me and play, and at least she got rid of the squeaker toy in here. I've tried putting her out in the other room and turned on the TV for her, and no luck. Alright, so our second week is the prenatal experience. If I can get it to work. Alright, so overall, the goal of pregnancy is to keep the mom in maximum mental and physical health wellness, as well as the delivery of a healthy full-term infant. So, a little bit of background. Most of you may know that pregnancy is divided up into trimesters. First trimester is from conception to about 12 weeks of pregnancy. Second trimester is from weeks 13 to 28. Third trimester is anywhere from 29 until delivery. Average length of pregnancy is 40 weeks, but as you all may know, some babies come early and some babies come late. Sorry about my daughter's dog. So some of the physical changes in the mom because of pregnancy, that uterus is actually going to enlarge a great deal. It starts out pre-pregnancy where it's a 3 inch by 2 inch by 1 inch organ that weighs 2 ounces. And then by the end of pregnancy, it's actually 11 inches by 9.5 by 8.25 and actually weighs almost 3 pounds. So that the uterus does grow a great deal during pregnancy. Mom's going to experience Braxton Hicks contractions. This is actually where the uterus is contracting, but it is not doing any, it's not doing it effectively. We'll get into more of the effective versus ineffective contractions later. But these contractions are irregular. Generally, they are not painful, although they may, sorry. Are you done, Kate? They're generally not painful, and they will tend to stop if mom gets up and walks around. If they are true contractions, when mom gets up and walks around, they'll get worse. The cervix becomes kind of that bluish purple color you see there. And the mucus plug is actually mucus that works as a plug. It plugs the end of the cervix so that nothing can get up and enter the uterus and get to the baby and cause problems. Once mom actually starts dilating and opens up, generally they're 2 or 3, 4 centimeters dilated by the time that this mucus plug is expelled. Generally it is the telltale sign that labor is occurring or imminent. Oh, I give up. This dog is driving me nuts. I apologize. I've only restarted this like 5 times. Kate, go lay down. Go lay down. Alright, physical changes of the mom. I shouldn't even talk to her. No, she's jumping. Go lay down. The vagina actually turns that bluish purple color as well. And the secretions are thicker, they're white, and they're more acidic than they generally are. Mom's breasts are going to be larger. The areola are going to be darker. Nipples are going to be more erectile. Mom might develop stretch marks. And during the end of the last trimester, mom might actually start to leak colostrum close to the time that baby is coming. Um, and then they will continue to have the colostrum for a couple days after baby does come, this colostrum will turn into milk for the mature milk for the baby. Respiratory system. Moms are going to, as they grow, that uterus, that baby is going to be pushing up on the diaphragm. Are you going to go away? Go. Go lay down. Go lay down. Go. Anyways, while the baby grows and the uterus grows, the diaphragm is going to elevate because they are pushing up on it, and moms are going to notice a harder time breathing. They need more oxygen. They're going to notice some nasal stuffiness. They're going to notice some nosebleeds, maybe some hoarseness. Here, play with your book. Oh, sorry. Cardiovascular system. This is a big one. There are actually a lot of changes that happen to mom during pregnancy. During pregnancy, mom's blood volume actually increases by about 40 to 50%, about half, which actually makes the heart work harder, and the pulse may increase up to 15 beats a minute. Basically, the cardiac output is increased. I think it's like 10 to 31%. And some moms doesn't bother, and some moms it can be very, very debilitating. Some moms might experience supine hypotensive syndrome. Um, as a pregnant mom lays down on their back, the baby in the uterus will lay right on that vena cava, and it will lower blood pressure, and it will decrease the blood flow to the right atrium. Mom's going to be dizzy. She's going to be pale. She's going to feel clammy. And it bothers quite a bit of the circulation for mom and babe. So when, if we have a mom that's experiencing this or telling us about it, make sure that we're telling them that they should lay on their side or put a pillow under one of their hips so that they're not laying flat on their back. The more you can get them off their back, the better. And ones of you who have been pregnant before, I don't know how any pregnant lady lays on their back. More cardiovascular. Moms that are taking iron supplement, their RBCs increase by about 30%. And moms that are not taking iron supplementation, they're still increased, but only by about 18%. Leukocyte production increases. Generally around 4, can increase up to 12,000 during pregnancy, and even as high as 25,000 during labor. Moms are generally in a hypercoagulated state, as their clotting factors will increase during pregnancy. And moms may also experience what's called pseudoanemia, where their hematocrit decreases. It's not true anemia because when you start out with, I don't know, well, it's kind of hard to do this without you guys seeing me, but if you start out with 2 ounces of blood, or even if we wanted to say we had 2 ounces of water in 2 cups, 2 ounces in each cup. If I put a teaspoon of salt in each cup, it's going to be the same. But in 1 cup, I'm going to add another 2 ounces of water. And And the amount of salt that is in the one with the 4 ounces is actually going to look like they have a lower level or lower amount of salt in it. And that's what happens with the pseudoanemia. The hematocrit is decreased only because the volume, remember, because mom's blood volume is going to increase by 40 to 50%. So that's what this is. It's basically, yes, their hematocrit is lower, but it is because it's more diluted. If you guys need help understand that one, just let me know. Stomach, mom's going to experience nausea and vomiting, which is more common during the first trimester. They may bleed easy. They may have an increase in drooling or saliva. They might be more bloated, experience constipation. They might complain of more heartburn symptoms. When I was pregnant with my kids, I had horrible heartburn, especially my last one. I think I ate a can or a thing of Tums every day. And every time, oh yeah, your baby's gonna have a lot of hair. No, all my kids came out bald. I just had heartburn. So there is a wives' tale that the hair is related to it, but related to heartburn. But I'm not always sure that's 100% true. In the urinary system, moms are going to be peeing a lot more. The filtration rate increases, so therefore they are putting out more urine. They might see sugar spilling over in the urine because the kidneys are unable to reabsorb the sugar. And this is when they see this is when they're going to be really watching and checking for gestational diabetes. Skin and hair. Moms are going to have the linea nigra. It's basically just a line from the pubic area up to the belly button. Sometimes it goes a little bit higher. It's that brown line that develops. Chloasma. You can kind of see it on this picture. You can see where the right side, it would be her right side. The skin's darker on the cheek and around the eyes. It's called the mask of pregnancy. And then it goes away afterwards. Striae, which is also called stretch marks. These occur anywhere on the belly, the thighs, the buttocks, and the breast as the mom's body stretches. They may always have some sort of scars from these, but they will lighten. This very pregnant mommy's stretch marks are very pink, very purple. But once baby is delivered and mom goes postpartum for a little while, they'll generally turn silver. The joints in the pelvis actually relax, and that's what causes the waddling. It's pregnant waddle. Their center of gravity actually changes. And then they are at rest depending on how fit they were before pregnancy and if they have a history of it, where the abdominis muscle actually would separate because that uterus is putting pressure from the inside. And as you can see on the picture on the right, the muscles of the stomach, the six-pack, actually separate. Some women report that they have decreased attention, concentration, and memory. I don't know if that there's any study behind this, but I've always called it mama brain. I don't know if there's actually any physical behind it or just the idea that, mom's getting ready for a new baby and that's kind of what her mind is taken up with. Oh, let me go back one here. Couple anyway. Back to musculoskeletal. Some of the other changes that mom might see is lordosis, where their lumbar curve is changing, which will cause actually causes the lower back pain. They might see more like carpal tunnel symptoms because they're retaining water, and that might be actually pushing on the median nerve. And they might have an increase in sciatic nerve pain just because of where the baby's sitting and how the pressure is being exerted onto that area. So there is quite a few musculoskeletal things that change. All right. Recommended weight gain. Know these numbers. For a person who is of normal weight, generally the recommended weight gain is 25 to 35 pounds. Somebody who is overweight, they recommend that they only gain 15 to 25. For somebody who is in the obese category, which is greater than 40 BMI, they're recommending that they gain 11 to 20 pounds. Now going the other way, for somebody who is underweight, they actually recommend that they gain anywhere from 28 to 40 pounds based on how far underweight they are. So during pregnancy, they recommend that moms are gaining 3.5 to 5 pounds. Yeah, one place says 1.1 to 4.4. This other place says 3.5 to 5 during first trimester. But as you can see, it's below 5 pounds during first trimester. And then afterward, it is generally a pound a week for second and third trimester. So 12 to 15 pounds average. Moms are going to retain more water. Not only is their blood volume increasing, and that's where it's going, but it's also going to the baby and to the placenta and contributing to the amniotic fluid. Plus, once they've been on their feet for all day, it's going to be in their ankles and their legs and you name it. When moms are pregnant, they need more protein because that'll help for breast milk. They'll need more carbohydrates. And fats are actually absorbed more during pregnancy. Alright, thyroid gland. The thyroid gland actually enlarges during pregnancy. The one part I do want to make a correction here. The anterior pituitary does not produce, it suppresses. So this should be suppresses. Suppresses the follicle-stimulating hormone, the luteinizing hormone, so that mom is not ovulating and not growing eggs. It prolongs, or when the anterior pituitary is suppressing, they're shortening their time for conception. Obviously, they're not going to be becoming pregnant once already pregnant, but it takes care of that corpus luteal phase. And then since they're suppressing the prolactin, this is when actual lactation is going to start occurring. Oh, for God's sakes, that dog has now gotten a bottle. Alright. Pituitary gland. They're going to be producing vasopressin, which causes vasoconstriction, which in turn is kind of an antidiuretic per se, that's going to monitor or manage blood pressure. It's going to manage how much fluid mom retains. I shut that noisy dog out. The adrenal glands. I skipped oxytocin. When oxytocin is released, this is what actually causes the uterus to start contracting in labor. And then after baby's delivered and the placenta's delivered, they're going to continue to release oxytocin, which is also going to cause the letdown reflex so that mom can nurse the baby. We'll get into it a little more in depth later. Adrenal glands, don't get too caught up in all of this. Aldosterone is kind of a protective mechanism for diuresing themselves. The pancreas, the islets might become more stressed just because they're trying to meet all these insulin demands caused by the increased carbs, and which is where the gestational diabetes comes in. So have an idea of how these all work. If you have questions, please let me know. We'll get it. We'll figure it out. So, signs of pregnancy. Subjective or presumptive changes. This is any sign or symptom of pregnancy that the woman experiences or reports. It is not proof or positive sign of pregnancy. It is generally when a woman experiences this, yes, it can mean pregnancy. But anything that is presumptive, there can always be a possibility that it could be something else. So, amenorrhea, woman stops getting their period, immediately they think, oh, I'm pregnant. Yeah, that is a good sign of pregnancy, but there can be many other things that cause a woman to stop her period. Nausea and vomiting, like I said, the first trimester is the worst, so they may contribute this to being pregnant. Tired, excessive fatigue. Usually during the first trimester, mom's pretty worn out. Mom will be going to the bathroom more often. She may experience changes in her breasts, or they may be tingling, or they might be painful. Or mom might feel what she thinks is the baby moving. All these signs really sound like, oh yeah, if somebody came to you and said, I'm feeling this, and this, you're like, oh yeah, you're pregnant. But every one of them, like I said, there can be another reasoning for it, like amenorrhea. Maybe they're anorexic, or maybe they're starting to go through the change through menopause. Nausea and vomiting, they could have the flu. Excessive fatigue, they're tired, they're not feeling well. Urinary frequency could be a UTI. Changes in breasts, you could contribute that to many other things. And even mom feeling fetal movement, they just feel like a fluttering sensation, so we could contribute that to gas. I know it sounds like I'm trying to make excuses, but I have seen this. I had a patient who was actually swore up and down she was pregnant. And the test kept coming back negative. She's like, no, I'm pregnant, I know it, I felt the baby moving. So then talking with her, we figured out that, she would have been 10 weeks along, which is too early to feel the baby move. But she felt that she was sure she was pregnant. Kept watching her, nothing else was checking out except for she said she felt this. Come to find out, it was gas, and she was feeling gas bubbles, but she perceived them as baby movement. And come to find out, she had wanted a baby, her husband did not, and so she was trying to hold on to that idea. But it was kind of crazy to actually see it. This slide, it should not be presumptive, it should be probable. I apologize for that. These are more what the doctor deals with. It's phonic souffle and uterine souffle. Don't get too worked up over these. We don't deal with those very often. But a probable sign of pregnancy is a positive pregnancy test, where they're actually testing the blood or the urine for the HCG, and they can pick this up pretty early. I've seen some very, very early pregnancy diagnosis that were caught on accident. Mom was in getting a MRI or a CT, I can't remember which, and they said, well, any chance you'd be pregnant? No, we've been trying for 3 years. I'm not pregnant. Well, let's run a test just to check. And it was elevated by like 5 or 10, not very much. They said, oh, well, then we're going to hold off on the MRI. Come back in 3 days. She came back in 3 days, and sure enough, it was elevated enough, and she was pregnant. So, that's the probable. Continuing with probable changes, the cervix becomes softer. This is called the Goodell sign. Remember we talked about the vagina and the cervix and the vulva all becoming like a bluish purple. The mucous membranes, well, like I said, will become bluish purple in color. This is called the Chadwick sign. The McDonald sign is basically the uterus is flexing against the cervix. And then the Hagar sign is the softening of the uterus. Some other probable signs that we kind of feel are pretty, not definitive, but are probable, pretty likely that mom is pregnant. The belly's getting larger. They cannot say that this is a definitive because there have been instances where there is it's called the hydatiform mole. Everything is present for a pregnancy except for where the baby would be is actually a tumor. It's really kind of crazy. Braxton Hicks contractions or changes in the skin, fetal outline, or ballottement is where like the nurse or the doctor pushes up against the cervix. The baby moves up and comes back down. This isn't felt. Baby has to be pretty far along to feel this, but you can feel it when they get, I don't forget how early you can feel that, but baby will come back down and actually return to where they were initially, but you can feel the baby leave and come back. So, positive changes. Fetal heartbeat can usually be heard at 10 to 12 weeks. Fetal movement, not just mom feeling it. Sorry, my dog's drinking again. I told you this is the most annoying dog you will ever meet in your life. That the... Kate, go away. Kate, stop. I will feed you later. Fetal movement that the nurse or the provider can actually feel, not just what mom feels, but the provider feels it as well. Or they can see the baby, the fetus, with an ultrasound. Early on, they can use what's called an internal ultrasound, where they actually insert that into the vagina, and then they can see the baby, the fetus, earlier than they could with the one that goes on the stomach. And sometimes if it's too early, they may actually just be able to see the gestational sac and not be able to determine that it's a fetus. I think that starts about 6 weeks, where they can actually see. Oh, so what does mom have to accomplish? In the first trimester, mom's going to have some uncertainty. She's going to be ambivalent to the whole idea, especially if she's a first-time mom. And she is going to be the primary focus. She's going to focus on herself, and she's going to focus on herself feeling better, especially if it's one of those pregnancies where they're got morning sickness or anything else. So basically, during first trimester, they're worried about what's going to happen, and they are worried about taking care of themselves. During second trimester, they're actually starting to physically look and feel pregnant. So their focus actually turns to the baby. And they will also focus on some of their body changes and some of the signs and symptoms that they're experiencing being pregnant. Third trimester, they're going to be more worried about labor and delivery and getting ready for it. They're going to feel unattractive. And they're going to be more focused on making sure everything's ready for the baby, the nursery, the anything that they need. And this is during the third trimester, closer to birth, is when the mom's going to be nesting, and generally they're going to clean the house from top to bottom because the baby needs to come home to a clean house. So that's the psychological tasks of mom. Psychological tasks for dad. During the first trimester, they're obviously they're going to be excited, but then they start to feel left out because there really isn't a whole lot of stuff for them to do yet. They might be confused because mom's going to be having mood swings. And then when they think about their baby, they generally think about a 4 or 5-year-old. If they're expecting if they're wanting a boy, maybe they'll picture themselves playing baseball with their little boy or whatever. Second trimester, their dad's role is still a little bit vague, but the more he sees and feels and can actually see that there's a baby in his partner's belly, he'll feel a little more involved. Sometimes the dads actually have can be increased or it could be decreased sexual interest as their partner actually grows with the pregnancy. Third trimester, one of the biggest fears of dad is hurting baby during intercourse. They start to be concerned about labor and delivery, start to wonder about what kind of parents they're going to be and how they're going to work through everything. And sometimes during third trimester, dads might actually develop what's called KUVAD. Basically, all the symptoms that mom is dealing with, dad starts to develop. And I never knew this was an actual thing, but I've actually experienced. When I was pregnant with my oldest, my best friend Chris called me one time, and he's like, I think I've been hanging around with you too much. And I said, yeah? He goes, I just ate string cheese dipped in yogurt. I was like, okay, why? Because I was craving it. So I didn't even, I didn't even know, but it happens every once in a while. All right, going to pregnancy terms. Sorry, I keep moving around here. Gravida, any pregnancy, regardless of how long it lasts, including the present pregnancy. So any time that mom has been pregnant whether the baby has been born, whether the baby has been stillborn, any of it. So any time that she's ever been pregnant. Para is any birth after 20 weeks. Does not matter. Well, that sounds kind of bad, but regardless of if the baby was born alive or stillborn. So they may have had a stillborn child at 24 weeks, and that would be considered a G1 para 1. Nulla gravida is a woman who's never been pregnant. Prima gravida, if you break it down, primary, a woman is pregnant for the first time. Multigravida, second or later pregnancy. And a nullipara, who is someone who's never had a birth after 20 weeks gestation. They've never carried a baby past 20 weeks. So somebody who is pregnant with twins, that is considered one pregnancy, one birth. Just even though there are 2 babies, it is just one pregnancy, one birth. Primipara, if you kind of break down the word, you can tell that it's a mom who's had one birth at more than 20 weeks. Multipara, 2 or more births after 20 weeks. The antepartum is basically the prenatal period. The intrapartum, from the onset of true labor to the time that baby is delivered. And postpartum is any time from the time that the placenta is delivered to the time that the body kind of returns to their pre-pregnancy state. Generally speaking, this usually happens in about 6 weeks, but it may be more, maybe less by a little bit. That's just the average. So you will see TPAL anytime you work with a laboring or a postpartum mom. So a T, number of early, full, or late term births. P is for number of preterm births. Whether the baby was living or stillborn. A, anything that was a spontaneous or a therapeutic abortion, just meaning basically a miscarriage or an act or a physical act where they had a procedure done. So that covers both of it. And L is currently living children. So any time that they've given birth is the T. P is the number of preterm births. A is for abortion, basically how many miscarriages or procedures they've had done. And L is living children. So determine a due date. You will see these in every labor and delivery and prenatal clinic everywhere. It's the calendar you spin around. You determine their date of their last period and subtract 3 months and then add 7 days. You can see the example on there, but that little circular thing is right there as well, so that kind of helps. Makes it a lot easier. But yeah, if you figure out first day of their last menstrual period, subtract 3 months from that. So say what is today? September 12th? 13th. September 13th. 3 minus 3 months is June 13th. And then add 7 days is June 20th would be their due date. So let me just double check my turns here. Danger signs of pregnancy. Anytime that there is a sudden gush of fluid from the vagina, depending on where they are at in the pregnancy. It may be blood or it might be amniotic fluid. Anytime there's any vaginal bleeding, anytime there's abdominal pain, if mom has a temperature over 101 degrees Fahrenheit, she needs to be checked out. Dizziness, double vision, vomiting, headache, edema of the hands, face, legs, and feet, muscle irritability, convulsions. Those are all signs and symptoms of preeclampsia. All of those need to be looked at. If a mom just has edema of her ankles and she's been at work for the past 8 hours, that's one thing. But if the edema is spreading where it's on her hands, her face, her legs, her feet, all kind of more generalized than just specific areas such as just the ankles, that's one thing. But if it's more spread out, then yeah, that gets to be a little bit of a worry. Epigastric pain, problems urinating, or any time that the mom does not feel fetal movement. And a lot of OB wards say if you can't feel the baby moving, come in. We'll put you on the monitor and we'll check baby out. So anytime that your patient is experiencing any of these during pregnancy, encourage them to go get looked at immediately. We kind of went over we went over a lot of these. Discomforts of pregnancy, nausea, vomiting, frequency, fatigue, breast tenderness, increased vaginal discharge. Yeah, we went over all of these. Second and third trimester, things are getting a little more intense. Baby's growing and putting pressure and pain in all sorts of different places. Mom's having a hard time sleeping. She can't get comfortable. She's short of breath because there's no place for her lungs are getting squished up. She might be a little bit faint due to that pseudoanemia, or she might have leg cramps, constipation, hemorrhoids. Yeah. We all know that these are toxic for the babies. So, prenatal visits. Mom is going to come into the clinic. In the first trimester, it might be every month. Second trimester, it's going to get a little closer together, but maybe like every 3 weeks. Beginning in the third trimester, they're going to start scheduling every 2 weeks. And then for the last month, it's going to be at least weekly, so that they can keep an eye on how mom's doing, making sure she's not starting any symptoms of preeclampsia or any other warning signs. First visit, the provider will confirm that mom is pregnant, either the blood or the urine test. They will help estimate the due date. There's a gravity and parity, so they will determine how many babies they've had, how many babies they've lost. They'll take a medical history, family medical history. They do a physical exam, and it can be a very emotional visit for mom and dad, whoever else is in the room. Different things that they will look at are mom's vitals, how much weight she's gaining. They'll check the fundal height just to make sure that baby's on the right growth scale or growth process. They'll listen to baby's heart. Might check a urine every time. They'll double check for edema. And then they'll take the time to do some teaching. Some of these, I don't want to get into some of these the quadruple screen and all of that. But there's an indirect Coombs done on every mom that's negative. This is the Rh negative factor. They may be done at the beginning of the pregnancy, done again at 28 weeks, just to double check. I don't know if this is... Yeah, there isn't a whole lot. I did have some pictures up of the RH factor. So if a mom is RH negative and a dad is RH positive, 9 times out of 10, that baby's going to pick up the RH factor from dad and be positive, which is okay for the first pregnancy. Any subsequent pregnancy after that is when mom is going to need the ROGAM shot. Because during delivery, baby's RH positive blood is going to mix with mom's RH negative blood, and mom is going to start making antibodies. So, subsequent pregnancies, if baby is RH positive, again, mom's body is actually going to attack the baby's blood because the mom has built up antibodies for that. So if mom will be given a ROGAM shot at 28 weeks and then again right after birth to help prevent these antibodies from forming. The glucose screen is generally done at about 6 months to test for gestational diabetes. They, if it does come back higher, they will come back in a couple weeks and do an even further workup, or they might have you stay and drink, or have mom stay and drink some more. Gram beta strep. These are cultures that are done at third trimester. What was happening before? Because when I had my first kid, they never tested for GBS. What was happening was moms were positive for this gram beta strep, and then on delivery, baby was catching it when they were baby was catching it during delivery. Everything would be fine because most signs of infection do not show up within the first day or two. Babies would go home, they would be okay, and then all of a sudden they would have this horrible pneumonia or becoming septic and issues. So they had traced it back to this GBS. So now everybody's tested during third trimester, and if mom is positive for gram beta strep, then they're automatically given antibiotics during labor, and babies watched a little bit closer. So, and if baby starts showing any symptoms of an infection, they're treated right away. So they have really decreased the amount of infections that these babies are experiencing right out because they are screening for this. If they don't know mom's GBS factor, if it was never done or it's too early, they'll treat if mom or babe has a fever 100.4 or greater. I don't know why I put degrees. Rupture of membrane if it was 16 hours or longer ago. Or if baby is 37 weeks or lower for gestational age. Education really kind of depends on what mom is experiencing during each trimester. For the first trimester, we're going to be teaching mom the physical and the psychosocial and the emotional aspects of pregnancy. Especially during the first trimester, we're really going to teach mom how to take care of herself. We will teach her about teratogens and, smoking is bad for you, drinking is bad for you, and the baby. The first trimester, generally when people go in to get their pregnancy test, it's generally with a general care provider. So their first appointment or their first, during the first trimester, one of their major tasks they need to figure out is who they want for an OB provider, where they want to give birth, and set up their, they don't really start their birth plan, but they start getting ideas for their birth plan. And then we educate them on some of those discomforts that they start to experience. The nausea and vomiting that's really common in the first trimester. If you teach your moms to keep Ritz or saltine crackers at bedside, and before she even sits up, when the alarm goes off, grab a couple crackers, eat a few of them. It'll give her something in her stomach, and sometimes that helps with the nausea and the vomiting. But things like that for early, or issues they experience early in the pregnancy. Second trimester, we'll start teaching them kind of if they're planning on breastfeeding. Well, this is when we'll start kind of getting their ideas and kind of starting some of that type of stuff based on them. And then we're going to teach them their discomforts, that they're the relief of them late, the later pregnancy issues. Third trimester, it's going to be more where we're helping them prepare for childbirth. We're going to help them get a birth plan, help relaxation techniques for labor, breathing techniques. And then we're going to kind of start teaching them a little bit about how to take care of themselves after the baby's born, and then a little bit about stuff to take care of the baby after the baby's born as well. So like bathing, car seats. We'll start getting that stuff started in their brain, and then we'll finish teaching that after the baby's born. That's kind of, and that is it. Just want to make sure I covered everything. Yeah, that's. If you guys have any questions, again, give me a call, and I will try and get this posted up to the Blackboard site right away. All right, have a good one, guys. As always, give me a call if you need anything.